Hi, today we are going to talk about the cervical disc herniation, symptoms and treatment of this disease. My name is Dr. Kamran Aghayev. I'm an associate professor of neurosurgery. Cervical disc herniation is a disease that basically herniation of the disc material, which is a part of the joint between the cervical vertebrae, into the canal, which can compress the spinal cord or the nerves. In this session, we're going to talk about mechanism of the cervical disc herniation. So the human spine consists of many bones, as you can see here, and the joints between these bones. It's an elastic structure that allows our spine to move, and this elasticity actually comes from the joints between the bones. So we have four sections in our spine: cervical, thoracic, lumbar, and the sacrum. Each of them has specific functions, but the common function is to be able to provide the support for the body, is to protect the spinal cord and the nerves that are running inside the spinal canal, and provide elasticity or movement to the body. So these movements actually are provided by these joints in between the vertebral bones. In medical literature and in lay language, we usually call these joints disc joints because they resemble like a disc. They have oval structure. They may differ from side to side, but they have oval structure that has a ring, a very thick ring of fibrous tissue, and it has a core of the specific cartilage, which we call nucleus pulposus. So with time, this nucleus, which provides support for the joint, it may degenerate. That means it loses its properties. It gets dry. So with the dryness, the load is actually causing the nucleus to break apart, to get fragmented. And one of those fragments may actually slip and go back into the cervical canal and compress either the spinal cord itself or the nerve or the nerves that are coming from cervical canal and going to the arm. So this condition is called cervical disc herniation. What are the symptoms of cervical disc herniation? So because herniation puts a pressure on the nerves, so we have all the symptoms associated with the nerves. As you may know, the nerves convey the signals from the spinal cord to the arm, to other parts of the body, and then convey signals from the part of the body or from a specific organ back to the spinal cord. And when the nerve is compressed, there will be symptoms associated with the loss of function of that nerve. So going back to cervical disc herniation, the symptoms are usually pain, numbness, and weakness. These three cardinal symptoms, pain, numbness, and weakness, are at the very core of the cervical disc herniation. So usually the disease starts with the pain, and the pain has a very specific nature. It starts at the neck or in shoulder area and goes down to the distribution of the nerve. It may go down to the fingers, it may go down to the palm, or it may stay a little bit up in the shoulder area and not go beyond the middle of the arm. So stay somewhere in the middle. And In some cases, in more advanced cases, the patient will also complain about the numbness in the arm and the weakness of the arm. So the herniation itself, the compression of the nerve root, causes pain, weakness, and numbness in the arm and fingers. This session will deal with the treatment of cervical disc herniation. So, in vast majority of cases, initially disc herniation or cervical disc herniation is managed conservatively, which means not surgically, with medications, physical therapy, chiropractic manipulations, and other treatment options if they are available. So the main objective of this treatment is to alleviate the pain, which is the main symptom of this disease. In some cases, with the specific procedures, the treatment may slightly take pressure off the nerve and basically provide some relief. Other treatment options, a little bit more invasive treatment options, include injection of the steroids around the nerves, which is called epidural injection, or radiofrequency ablations, when the treating physician goes inside the disc joint and performs ablation of the disc joint to shrinken the disc and take off the pressure from the nerve. So these treatment options are usually performed on outpatient basis. They don't require admission to the hospital. But if the symptoms are severe, if the pain does not respond to conservative treatment, if there is numbness and significant weakness in the arm, and the symptoms are getting worse with the time, that actually reason for neurosurgeons to come and intervene. So when we do surgery for the cervical disc herniation, we do it for several reasons. We take off the pressure from the nerves and from the spinal cord, and we restore the height of the disc space, and we make sure that in future we will have no problem with this disc anymore. For that reasons, there are two surgical options available: fusion and disc replacement. So fusion is a little bit older technique. It's been used for more than 70 years now. It was developed in the 1950s. It actually works very good in the majority of the patients. So once the surgeon comes and removes the disc herniation and removes the disc totally, he or she performs a fusion, which actually joining the two bones together and making sure that there will be no motion there and there will be no disc herniation there anymore or any other problem there. But that fusion actually eliminates motion at that particular joint. So in the younger patients, that's not desirable. For that reason, we have treatment option which we called disc replacement. So after removal of the disc, after taking pressure of the nerves and the spinal cord, the surgeon inserts an artificially designed disc joint there to restore the motion and at the same time to avoid future problems. Thank you for watching this video regarding the cervical disc herniation. You can find more information on our website.